Hi, Dr. Henry and Minister Dix. I just wanted to see if you have given any thought yet to possibly starting the Christmas break sooner this year for schools, namely in the Fraser Health and Vancouver Coastal Health regions, but possibly across the province.
Yeah, so this is something I've been looking at for some time, whether, what measures we need to take. And we know that schools, and I presented the data again yesterday, schools are a reflection of what's happening in our community. So we're looking at what are the measures that help us reduce risk in our communities and therefore protect our schools more. We can see that transmission rates are less in schools than they are in other parts of our community. So they are also, we know, incredibly important for families and for children to have in-person, in-class schools. But we're looking at all of our options. There are a whole bunch of things that are happening, hopefully, within the next months. We need to bend our curve back down. We need to make sure that we're doing everything we can in the community so that we can continue to have our in-classroom schooling going for children across the province. So there's other measures we're looking at as well. But across the country, we're discussing all of the options that can help and looking at the data to support them.
Yes, and this is for my colleague. It's thought that the music teacher at Cambridge school in Surrey could be the source of transmission for some of the students. And just wondering, should specialty teachers be able to teach hundreds of kids across multiple cohorts?
Yeah, I know it's a really trying situation, and we're sending all of our positive thoughts and wishes to the teacher in question. I don't know the details of who was exposed to whom. I know that the initial exposures were from a community exposure, and then there was transmission in the school environment. It's a very good point, and we are looking at all of the initiatives around some of the specialties teachers, particularly music and physical education, where we know there's multiple classes, and making sure that the appropriate safety precautions are put in place for those to happen safely. And this, of course, will make us rethink, relook, make sure that things are being done in the best way to protect people.
I'd like to ask about what Marcella brought up at the beginning around the school year, and you said you're speaking to federal counterparts about this. What are the pros and cons in either bumping up the school break, as in sending kids home early, or extending it into January? Are there thoughts on the pros and cons of that? And what is there a number of cases or number of outbreaks that would lead the province to make these changes around the break schedule?
Yeah, so it's not so much the school exposures that we're seeing. It's the community, but it's also looking at, the things that we're doing in our community. So and I'm talking with my colleagues, so the chief medical officers of health in the other provinces, and we're all considering, what makes sense, what information do we know, what's the data that we have on what's happening both in communities and schools. So we know some of the downsides are that there are many essential workers in our community, and finding places for children to be safely during the day needs to be considered. We know that older children will naturally congregate in other settings. So how do we make sure that those aren't more risky than some of the things that we're seeing happening now? So there are many different considerations that go into this. We want to make sure that we can do it in a way that doesn't adversely affect those businesses that are running safely. But we also want to make sure that our healthcare workers are supported, that they're able to continue functioning. As you know, this is a run-up to where we tend to have more people in hospital for a variety of reasons, and we're now, of course, seeing a surge in COVID patients as well. So there's many considerations that we have. From a medical perspective, I also know that this is the time of year we tend to see over Christmas and into New Year's, where we tend to see influenza surge. We're hopeful that this year the measures we're taking might help prevent some of that, and that's important. We also know that people want to spend time together over holiday seasons, and that can spill over into outbreaks in community settings afterwards. So there are many different things we're considering, and we need to have an understand what the impacts are going to be. And I don't know all of them, so we're consulting with different groups, and we'll continue to do that. But if we are going to make this change, it will be a thoughtful change that will be done ahead of time in discussion with the different stakeholder groups.